Thank you all for participating. I first of all want to say this is not affiliated with UF Health. This is actually a school assignment. The topic up for debate is providing health care and end-of-life care to those that are incarcerated and they're serving a prison sentence or they're waiting for their court hearing as they face jail time.
Ethical questions brought forth by this topic are to what extent an inmate should receive health care treatment and who should pay for it. As registered nurses and associate care providers, we may be called upon to care for inmates as dictated by the contract between the hospital and the correctional facility.
This presentation is designed to address those ethical issues that stem from providing acute health care to inmates and the legal reasons that treatment is provided to them.
When a prisoner is admitted to a hospital, it's because they are in need of treatment that cannot be provided at the jail or prison. The incarcerated patient can be a young adult or a senior who has been incarcerated for decades. The patient may have been injured while committing a crime and has not yet officially faced charges in the courtroom because they require medical treatment. Once the treatment has been completed and the patient is cleared for discharge, they will return to the facility. The patient may be diagnosed with a life-ending illness and continues to seek treatment to prolong life, or the individual is refusing treatment, choosing to shorten his or her lifespan while being the responsibility of the institution. Under the 8th Amendment of the Federal Constitution, prisoners are guaranteed adequate medical care. As a general legal principle, a majority of states' courts will compel an inmate to submit to medical treatment if it is deemed necessary to preserve that inmate's life and prevent suicide, protect the wishes of the family, safety of others, and protect medical ethics.
The normal standard of practice outside the prison system is that physicians are talking to patients and their families about treatment options. But the patient and their family actually are the ones that get to decide how to proceed.
Can an inmate legally give informed consent or refuse treatment? The AIDS epidemic refocused these discussions. According to Dubois, in the early and middle years of the epidemic, almost all interventions were only available within protocol. It was during this time that inmates sought access to the research. The result was inmates could give consent, which extended to procedures as well. That consent led to the right to also refuse care. But as noted earlier, this is a distinctly different discussion in correctional settings. This equality of moral choice may be restricted.
Now, the subject of refusing medical treatment can be confusing in the prison system, so here's the legal breakdown.
The United States Supreme Court has ruled failing to provide adequate health care is considered cruel and unusual punishment and is therefore a violation of the 8th Amendment. The court has also decided that inmates have a due process right to refuse medical treatment because the right to self-determination is too important to be denied, even for prisoners. If a prisoner is of sound mind and makes decisions for his or herself, and as long as that decision does not threaten the safety of others, for example, refusing antipsychotic medications, the prisoner can refuse treatment even if it will lead to death. However, there are a number of cases that are individual and unique in nature and have ended with a different ruling. Let's take a moment and read over this case study right here as an example.
A 47-year-old male patient with probable stage 4 laryngeal cancer was transferred from prison to the hospital for evaluation and respiratory monitoring. Before incarceration, the prisoner had been told of a laryngeal mass that would eventually result in airway obstruction and certain death. He refused treatment and was deemed sound of mind. His respiratory status continued to deteriorate. The medical team wanted to support the patient's wishes not to receive aggressive treatment. His family was notified and they supported his wishes. Because the patient was a ward of the state, prison staff mandated a full code status, which included an emergency tracheotomy and ventilation. After meetings and committee hearings, the patient's wishes were finally upheld and he was terminally decannulated.
Health care is not free, even in correctional facilities. Most states have incorporated co-payments for inmates seeking medical treatment. The co-payments are often paid from the inmates' commissary accounts. These accounts gather funds from prisoner families and money they make doing prison jobs. Ethical dilemmas that arise from charging co-payments are co-payments may deter inmates from seeking medical attention. On the other hand, there are those that are not incarcerated and do not have health insurance, and the benefit of having a co-payment for medical services. That's the civilians out there. Prisons use co-payments as a way to raise revenue and decrease demands for unnecessary frivolous treatments. There are many gray areas, though, when it comes to health care in the prison system.
So hopefully this presentation has provided a legal foundation as to what the courts have decided. And with some of these topics, there is no cut and dry answer out there. Perhaps this information will be useful if you ever find yourself caring for an inmate or someone in the prison system in the future. Thank y'all very much.
You're welcome. So informative.